Welcome to today's webinar, Navigating Global Outsourcing, the Benefits and Challenges. This is Ashley Becker, HFMA's Manager of Client Services, and I will be moderating today's session. Now it is my pleasure to welcome today's speakers. Lakshmi Patel is Chief Strategy Officer for Savista and brings a unique perspective with her background in consulting, human resource, and strategy. At Savista, she is responsible for growth strategy, service line management and expansion, automation, continuous improvement, and M&A. She utilizes a data-driven approach to align process, people, and technology to create a positive impact for their colleagues and clients. Gretchen Payne brings over 25 years of experience in healthcare finance to Core Clinical Partners. Prior to Core, as VP of Finance and Revenue for Schumacher Clinical Partners, Gretchen was responsible for all budgets, projections, and overall financial viability. Her experience includes leading revenue cycle teams in the finance department for a company that grew from 5 contracts to over 150 during her time. And Erica Grotto is a senior editor at HFMA. At HFMA, she brings together her experience working in newspapers, higher education, publishing, and entertainment as the producer and host of HFMA's podcast, including Voices in Healthcare Finance and Healthcare Blame Game. And with that, Erica, I'll turn the presentation over to you.
Fantastic. Thank you, Ashley. So to our speakers, before we get started, do you want to talk a little bit about the organizations that you came from?
Hi, great, Erica. Thank you for the introduction, Ashley. So as Ashley mentioned, my name is Lakshmi Patel. I'm the Chief Strategy Officer at Savista. Savista is an end-to-end revenue cycle organization. We serve over 800 clients, offering services, anything from registration to bad debt and everything in between. We have a talent pool both domestically and globally in India and the Philippines. We specialize in customizable solutions to solve the unique revenue cycle challenges of our clients, whether that includes a work down, staff augmentation, or a full outsourcing of their revenue cycle function. Gretchen, I'll turn it over to you.
Okay. I work with Core Clinical Partners. I'm the Chief Financial Officer. We're a physician-found and led emergency medicine and hospital medicine practice group. We provide physician services, revenue cycle management, and general healthcare consulting. We're currently operating in about 10 states with 45 different facility locations, and we're seeing about 1 million patient visits a year in our space.
Great. So I think to start us off, do you want to talk about the learning objectives?
Yeah, so our objective today within the webinar is to ultimately help understand the challenges and goals of a global outsourcing. Understand the key areas within the revenue cycle that are suitable for outsourcing and how to evaluate those factors influencing the decision. Explore the roles and responsibility in optimizing operations, includes policy adherence, kind of best practice implementation. And then really go over some KPI measurements, both globally and domestically, that should be used within some of those service lines.
Fantastic. And I think we're going right into a poll question. Have you ever utilized global talent to support your revenue cycle operation? I'm curious to our panelists, what in your experience, what do you think we're going to see here?
Globalization in general has become very popular in the last few years. And so I would assume that at least half of the audience has somewhat kind of experience from a global, whether they've used it themselves or worked at an organization that have used global talent.
Good. Well, whether they have or not, right? There's a lot to learn here today. So should be interesting to see. I'm excited to dive in once our results come back here.
Yeah.
Just give everybody another minute. Okay, so not quite 50-50, yeah. but yeah.
Well, that's great though. Then hopefully for the audience members that have not used it, we can kind of go through some of the benefits and potentials as they kind of evaluate that as an opportunity.
Absolutely. So let's dive in. Let's talk about the concept of globalization within healthcare revenue cycle management. What is it exactly? And can you talk about some of the benefits and potential challenges?
Yeah, typically when you're talking about globalization, specifically within revenue cycle, it ultimately means leveraging resources or services or even expertise from outside of the United States. Global can mean many things for a lot of organizations. Typically, from an industry perspective, payers have been doing global work for 30 plus years with call centers and customer service centers in India and Jamaica and even Eastern Europe from in the 70s and 80s there. Providers shortly followed after that, with majority of outsourcing being in India. There from a revenue cycle perspective. However, over the last 5 to 7 years, the Philippines has also become a sought after location as it boasts one of the largest clinical talent pools in the world. And it's typically ranked somewhere between 3rd and 5th place with the largest English speaking population in the world. So there are many functions that are outsourced, but typically when we're talking about revenue cycle, we're talking about medical coding or billing or claims processing or AR kind of functions there. And as I was saying earlier, the popularity and the acceptance of globalization has grown more recently. The growing pressures of cost reductions and really needing some efficiency to drive kind of financial improvement has increased that demand for outsourcing, with 83% of health systems now outsourcing some component of the revenue cycle. And offshoring continues to be more acceptable and essentially a necessary solution. Initially, it was very much utilized as just a cost-saving measurement because labor pools in other areas like India tend to be cheaper than domestic. But now it's regarded more as a strategic viewpoint and a kind of a strategic strategy there. So the providers are starting to recognize the value into tapping into that global talent pool. It's a diversification of operations and even kind of offering those financial enhancement opportunities. So that shift in itself has created a lot of benefits. So cost savings, instead, it's number one, there allows opportunity to essentially redirect resources internally to patient care or infrastructure development or even other strategic initiatives. It allows us to access specialized talent. We're in a very difficult labor market. We don't have the education programs dedicated to creating a funnel of talent for revenue cycle. I mean, I didn't know revenue cycle was a career opportunity when I was in high school or college there. So there's a lack of understanding of that service as a whole. And even things like popularity and allure of like coding schools have gone down there as kind of the generation has kind of progressed. So globalization allows organization to access those specialized talent pools, particularly in areas, as mentioned earlier, coding and billing. Those professionals can kind of help improve from an accuracy and efficiency standpoint because they've been specifically trained for those services. Scalability and flexibility, by leveraging kind of those global resources, you have the scalability without needing to set up the infrastructure. So the HR, the hiring, the training there. And so you can adapt much easier to the needs of your business. And then also kind of operating this concept of a 24/7 operation. Globalization allows you to kind of work around the clock from an operation standpoint by leveraging teams in different time zones. So you can have that continuous processing of claims or coding as needed. There's a lot of benefits, but there's also some challenges to consider when looking for a global partner or even considering globalization. Data security and privacy is number one, I think, in most people's mind from an industry perspective. So that globalization introduces that complexity related to data security, especially when sensitive patient information is kind of transmitted across borders. So organizations have to really consider who their partners are and ensure that there's compliance to HIPAA and then kind of the general data protocol regulations. Best practice for data is typically to never leave US from a service standpoint and allow your global colleagues or team members to really access this data through a virtual desktop. And in some cases, the data actually that is being worked by global resources tend to be even more secured if that protocol is followed, because most global organizations, one, are in office, so you control outside environments, and two is they work in what's called a clean room environment. So no cell phones, no purses, no personal belongings are on the work floor. their desktops versus laptops, harder to move, and access is kind of limited to necessary IP addresses from a work perspective, including even personal emails there. But so those are things that really need to be considered and looked at when considering globalization. Quality control, making sure there's consistency in quality standards across the geography. You want to have one set of standards and kind of measurement of success there. And communication and collaboration, making sure there's an effective communication between the two different teams. There's difference in time zones, sometimes cultural differences, communication style that can hinder collaboration. So investing in the right team structure, cultural sensitivity training, or regular team meetings really kind of help foster an effective team environment. And moreoverly, I think with some of that communication, adapting a hybrid model, so blending offshore and onshore operation, can really remove some of these challenges.
Great. Thank you for that. So I think we're jumping into another polling question here. What value is the most important to you when you consider global outsourcing? Now, when we asked the first polling question, we know that only 35% have really considered it seriously. So what do you think we're going to see here? And maybe what would you like to see as the answer?
I mean, Gracia, I would love for you to weigh in on it, but I think most people always saw cost savings. It's what initially started globalization. I think it still is a big driver in considering an outsourcing component, but hopefully that access to talent is starting to move on up from a value chain perspective.
I agree. I think, the cost savings is what catches everyone's eye and kind of leads you down the initial path. But then we've learned just the access to specialized talent, like trying to find good quality labor in this market domestically has proven to be a challenge. But there's better access to more of these functions via our global resources. So that does take some burden off of us too as an organization when we can get access to this talent via our global partner in addition to cost savings.
Yeah, and it looks like, looking at the results, it looks like the two of you kind of called it here. Cost savings, access to specialized talent, definitely the top two. So yeah, we'll see in a few years whether people's answers to those might change as things change. So let's get into some challenges and goals. Gretchen, can you talk a little bit about your organization's revenue cycle challenges and goals, and what led you to consider global outsourcing?
Yes. So in the beginning, we followed the traditional outsourcing all of our RCM functions to a typical billing and coding company. All of the functions were done by a vendor. As we got bigger and larger and needed more scalability, we also wanted more visibility into our business. When you use a traditional billing vendor, they do a set of services for a set price, and that's what you get. But we wanted to dive in further. We wanted more visibility. And we, like everyone said in the poll, we wanted to get our costs down. Initially our billing and coding costs weren't significant, but as you get bigger and scale, then the costs become more material and you have to start looking a little bit more to save some cost. So it was a bunch of factors, primarily though, visibility, accountability, cost, and we just wanted to have more control of our business and know what we were working and how we wanted to work it. So we just kind of started to look around at what functions we were outsourcing that we could bring in-house to give ourselves more control and flexibility. And we ended up with a hybrid model. It's not an all or nothing. Like Lakshmi said, it's a hybrid between some domestic, some global. When we started this process, we looked at the areas where we thought we could get the most value for our money and where we could get the most revenue share increase. So we kind of picked those areas and focused there first as we started to go down the path.
Okay, and we are going right to another polling question. We want to hear a lot from the audience today, but that's exciting. Based on interaction points and complexity of work, which following revenue cycle function is suitable for globalization? Coding, complex AR, cancer registry, bad debt. Panelists, what are your thoughts here?
Yeah, we glossed over the chart a second ago, which we'll go back to in a second here, but I think the interaction point and complexity of work really influence where that suitability is. It'll also change from organization to organization there in the location of the global talent pool. There are nearshore opportunities that offer the same time zone, maybe multiple languages that you need, whether it's Spanish or something else, while others like India and Philippines have their own unique skill set. And so there's a lot of opportunity here. I think this was more engaging to understand, does the audience believe that these areas could be globalized or not?
Okay, some interesting results here. Coding certainly coming out on top. Cancer registry, not too many people seeing opportunities there. So
yeah,
interesting.
Yeah, it aligns with kind of what we're seeing from a cancer registry, that it's very specialized and certified solution. I don't know if anywhere actually in the industry we figured that out from a globalization. So the audience is actually correct. There is limited opportunity for cancer registry from a globalization standpoint.
All right, so Lakshmi, I think you wanted to talk a little more about this this chart here and success of globalization.
Yeah, I think this, and maybe Gretchen, you can start. This was really to highlight kind of which areas of the revenue cycle are suitable for kind of global outsourcing for us.
Yeah, and I could jump in and talk about where we started, and it's kind of similar to the polling question. Coding is one of the areas we started with, and AR. Our AR is not considered complex in my opinion, so we started with accounts receivable, coding, and we did some cash posting, all of which I felt weren't on the complex side. They were more on the more block and tackling side. So I think, like Lakshmi said, complexity matters. Pick things that are not as complex, or as I like to say, if you can flow chart a process and you feel like you can successfully flow chart 90% of that process with the if then what statement. If 90% of it can be flow charted, then you really should look at using a global resource for that. If you start to think about a process and you quickly get in the weeds and it's not flowing through a chart and you end up in all these complex situations, then it's probably not a good fit. So when we went through our business model, and everybody's business is different, we all have different niches, but ours was AR and coding was very much a process flow. And that kind of leads to the other point of whatever it is you choose to use your global resources for, it also needs to be auditable and measurable, because you want to know if it's working. You want to feel like it's a success, and you need to tell your stakeholders that the program's working. So is the process something you can audit? So are they doing it correctly or not? And is it measurable? Are they going through the number of quantities that you want done per day? So it has to be something that you can measure, audit, and flowchart. If it kind of checks all those boxes, then I do think it's something you should consider using a global resource. Lakshmi, do you agree?
Yeah, no, I definitely agree with that. So when kind of looking at when an organization is really thinking about where those opportunities are, I think it's good to look introspectively and really identify the elements that kind of meet that complexity from a low perspective, both on a work and then even an interaction point. You got to think about your experience that you want from a provider or a patient perspective too. Do you want that to be local? Do you want that to be domestically versus are you okay with a global colleague reaching out about self-pay or provider enrollment there? So I think some of that from a cultural standpoint impact that. So you got to consider all those interaction points and complexity of work when scoping the areas for outsourcing. But typically, some of the key areas within the revenue cycle that are really well suited and have been kind of outsourced for decades, coding. Coding was one of the first functions that were outsourced, especially in India. India and Philippines have a specific talent pool and training programs designed to support U.S. medical coding. Unlike the United States, from a popularity standpoint, it's actually increasing in India and the Philippines. Like that is a sought out career from a opportunity when kids get out of college there. So that can improve kind of accuracy, efficiency, even turnaround time, because you can operate the 24/7 skill kind of model, or to ensure that the right specialty is aligned to your organizational need. Billing and claim processing. So various claim and billing process tasks, including claim generation or submission, or even follow-up and kind of high-level denial management and payment posting, are all functions that can be streamlined within a workflow. As Gretchen mentioned, there's a lot of if-then statements within these. So that simple process fits really well within that function. AR management, so follow up on overdue payments or underpayments or kind of zero response inventory. Implement great strategies using these resources. Eligibility verification, so just making sure a patient is eligible for a certain procedure or authorization, verification of insurance coverage there, which some front-end process will actually impact from a billing standpoint and kind of reduce some of those billing times and maybe prevent denials from taking place. Credentialing, provider enrollment, essentially verifying that provider's qualification and licensing and credentialing process can be done very easily within India. And then analytics. So Global Talent Pool kind of offers that expertise in data analytics, reporting, even kind of predictive modeling. So something that's outside of the revenue cycle, but has tenants into it, can really be successful there. But these are just some examples. That it can vary by location. As mentioned earlier, like there are talents in certain areas that have a clinical footprint while others do not. And so like Philippines with the clinical talent, fun fact about the Philippines, 1 in 20 nurses in the United States are from the Philippines because they have specialized US RN training programs and colleges there. So that opens up opportunity for clinical denials or even case management or other patient interaction there.
All right, so let's talk about successes. What makes a global outsourcing relationship successful? Gretchen, you want to start?
Yeah, I'll start. I think the most important thing with global outsourcing is to have a partnership with your vendor. And I shouldn't have said vendor, a partnership with the global resource company you use. We had to stop thinking of it as a vendor relationship because that's what we had with our traditional billing company, and that's where we weren't happy. So this is more of a partnership. We kind of bring things to the table. We work together. We have an account manager, a domestic account manager on our global partnership, who's our go-to person. We can go to her with anything we need. She helps us with anything we need from the global perspective. So that's made it very helpful. The other thing that's made it successful is the fact that we consider them our in-house team. We don't consider them our vendor's resource. So, it's very much a collaborative process. Well, in the beginning, we had weekly calls where we would talk about what we felt was working, what wasn't working. Thinking of them more as an extension of your own team, which goes back to a hybrid model. A fully outsourced model might not make sense, but if you pick a few functions and you really consider them just your internal, we have an in-house AR team. It's 15 people. They're all global resources, but we consider them our AR team. So I think that helps make it more successful because it's not a traditional vendor relationship. I think that's really helped us. And then we also have SLAs and KPIs, which I think we'll talk more about in a minute, that kind of keep everybody aligned and on the same page. The other thing that's made it successful for us is we find our global resources are very easily scalable. So if your company's growing and you're worried about, when I get this new contract, how am I going to have the bandwidth to take that new contract on? When you have a global partner, it's much more easy to scale and increase FTE counts versus having to recruit and hire onshore internally, which is much more of a heavy lift. So it's allowed us as a company to be more flexible and agile as new business comes along, because we know we have this global partner in the background who's going to help support us through these things.
Yeah, and Gretchen, I agree. I think really got to operate as one organization. You can't look at it from a vendor perspective. It has to be from a partnership standpoint and really defining the goals and objectives of the program and making sure that you have a leadership team who is sponsoring and driving this initiative. It's creating this concept of what we call like a global centers of excellence there, where you are creating the policies and procedures along with our clients, making sure you act and behave as the same. There's expertise and nuances that come with using an outsourcing partner, but it's also making sure that there is no difference, no matter who you're interacting with, whether it is a provider, whether it's a payer, whether it's a patient, they shouldn't see the difference between a domestic colleague and a global colleague there. So kind of that cross-functional collaboration there. And then also, as you're defining that value chain, it's making sure you're aligned on those SLAs and KPIs. Gretchen mentioned, like, we'll get to the specific KPIs that can be used as an example, but that's going to be unique to the relationship and the organization. So having those conversations upfront, creating a structure of monitoring and a collaboration is really key from a success perspective there.
Let's zoom in a little more and talk about some of the roles and responsibilities in optimizing revenue cycle operations. Gretchen, do you want to start there?
Sure. I mean, a lot of this is in the setup and managing expectations from the beginning. We all know which parts we are responsible for. I just would caution against anyone thinking, I have a global resource now and it's all of their issue or their problem, and you just hand them the ball and walk away. I don't think that's going to make it successful. You have to approach it as a partnership where you kind of meet on a regular basis and kind of go back and forth to you kind of figure out what processes make the most sense for your team in this world. We have weekly meetings, we have huddles, we have an account manager, but we do see them as an extension of us. And I think the more you can make it ingrained with your company and your operations and your culture and your processes, I think it's going to be more successful.
Yeah, and this kind of highlights some of the incorporation and interaction points, both from an organization and outsourcing partner standpoint, and even from a domestic and global team. So it's really key, like, define your objectives. Why are you looking to outsource? What are your performance expectations there, and align on those service line agreements with your organizational goals, not just from a delivery from the vendor, but also how do they tie into your broader initiatives there. Monitor KPIs, both internally and with your outsource operations, and make sure that you're driving this mindset of continuous improvement there, because you're going to identify opportunities both internally and externally. Make sure there's a QA process and protocol. Gretchen mentioned earlier, like, one of the values of determining globalization is really, can you QA the process? Can you audit it? And so make sure that you have set up that process and protocol to make sure there's consistency and accuracy and compliance. And that goes across the board. You shouldn't have different sets of measurements for your internal team and your external team, and making sure you're conducting regular audits and reviews of these outsourcing function. Monitor compliance. Regulatory changes and payer policies are changing constantly. So make sure you have a process and infrastructure set up to make sure that that's a responsibility of the partner or yourself, or a collaboration there. Lead cross-functional team, comparing notes. Like, let's identify best practices. Let's make sure that we're learning from one another. Data, analyze data. I always say, from my consulting background, so you can never take a consultant out, no matter how long they've been out of the field, but data doesn't lie. Analyze the data, look at performance metrics to track progress, make sure you're measuring those improvement efforts that have been implemented. Communication. And Gretchen, I think you would probably agree that communication is probably one of the biggest benefits and need in order to align and create that value proposition for an organization. And be flexible. Things are going to change. Your priorities are going to change. Your patient mix may change, or your volume change. So make sure that you have a partner and a relationship that allows you for some of that flexibility there.
Great. Let's get to our next polling question. What do you believe is the most crucial factor for fostering a successful partnership between organizations and global outsourcing providers. I have, after having listened to the two of you for a little while, I have my guesses, but what are your thoughts?
From my perspective, I think the key is really, I think it starts with alignment of organizational objectives. I think all of these are very important, and I think they may be specific to the leader or the organization that is looking for a partner of what they prioritize one over the other.
As I read through them, I like them all. I'd like to pick all four if that's an option. I do think you need to almost have all four of these in order to be successful. And we're asking the audience to pick, but the integration of onshore and offshore team, I think, is really important, because if you try to just 100% offshore something just blindly, I don't think that that's going to be successful. And you always need to be doing quality improvement and QA and leadership and communication. I mean, I like all four. So all of the above is my answer. Question.
Well, that's not an option for attendees, but you can say anything you like, Gretchen. So yeah, and again, leadership and communication was the one that jumped out at me, because you pointed it out in the beginning as a challenge. Communication could be a challenge, but also something to really focus on. So I thought that was interesting there. But yeah, I mean, I can see certainly the value in every single one of these, and you want all of these to be there. So the two of you both have teased KPIs, but let's get into KPIs. What are some of the KPIs that you look for or that should be in place to measure the effectiveness of revenue cycle management, both globally and domestically?
I mean, from our perspective, we just focus on 3 areas, but, I can tell you a little bit about the KPIs that we use. For coding, to kind of like the chart saying, the big one is charts per hour, which, is going to drive your cost and is going to get you some cost savings as long as you're coding, an appropriate number of charts per hour. But then you also need to have a KPI on quality assurance with, a tolerable variance for correct charts, and constantly be auditing that. So your KPIs are both volume, process driven, and quality driven. So when it comes to coding, you have to keep an eye on both. On AR, there's the typical days in AR, clean claims rate. I really like to focus on reimbursement per claim once all the AR is fully worked. To me, that's an important KPI that we track. On KPIs, you just kind of have to also keep in mind there's, again, with communication, because we have set KPIs and SLAs set with Civista in our partnership, but sometimes things happen that we also have to be held accountable to, that we're doing something that's keeping them from meeting their KPI, and what is it that we can do to help them get that fixed. So it goes back to the partnership on the KPIs. It's not just, hey, Civista, I need you to keep up at this particular KPI rate. We also have to have open communication. Is what can we do so that you can achieve the KPIs, is an ongoing conversation that we have with Laxmi and her team.
Yeah, I think it's really important to have some sort of high level benchmarks to make sure you're kind of established from a goal and a scorecard perspective, but also the consistency of measurement. Are you looking at these daily, weekly, monthly, quarterly? And so alignment on the measurement period is also important, because things can fluctuate. These are set as examples. They're most commonly used in these 2 areas, but these are really going to be dependent on specific needs of the organization or what they prioritize there. So as those fluctuates, we need to make sure that these are essentially informing the direction of the relationship. So is that success really being created? And so, yes, you have the KPIs, but you need benchmarks, you need targets, what you're aiming for, and the timelines you're aiming to reach those targets there. When you're looking for an outsourcing partner, yes, you want typically 3 things. You want them to be better, faster, and cheaper than you. Otherwise, why would you outsource? And you need to be able to kind of measure those 3 things. And that should be kept in mind, whether you're looking at SLAs or KPIs there.
Okay, so we are going to get to some audience questions in a few minutes. I know that some folks have already put their questions in the Q&A box. But as we wrap up here, what's some advice that you'd give to fellow CFOs and rev cycle folks as they're considering global outsourcing? Laxmi, you want to start?
Yeah. I mean, global outsourcing can be a very strategic move for CFOs or other rev cycle experts, but it's really important, as we've said throughout, that to really approach it thoughtfully, really understand the core competencies that you have as an organization and the areas of opportunity. Identify the functions within the revenue cycle area that are core to your business and you want to keep house because that's your IP and you want to retain your in-house talent for that set of services. Look for an outsourced partner that you don't have the time, you don't have the skill set, or you don't have the kind of the energy to deal with there. Gretchen mentioned this earlier and we really highly choose a partner, not a vendor. Look for a partner that has a proven track record, has industry expertise, that will commit to quality and compliance and consider things like reputation and scalability and even cultural alignment from an organization perspective. It sounds very small and minute there, but being able to collaborate from a leadership standpoint and a frontline staff standpoint is really important. And do you believe in the same principles there? Establish that clear communication channels and expectations with the partner, making sure you're aligned on goals, timelines, performance metrics. What are your reporting standards and expectations? Some of these seem kind of basic there, but they're really important to have a transparent conversation at the beginning because you're going to create accountability from the start of that implementation. Making sure those scorecards are created and measured and you're looking at the formula the same way, both sides. So it's great to have a KPI that says AR over 90 days, but are you looking at 90 days from the bill drop or the date of service? So things like that need to be really defined early on. So you look at the value the same way. Remain flexible, adapt. Your outsourcing strategy may change. There are market conditioners, regulatory requirements, and even business priorities that'll change over time and may change the necessity of outsourcing or not there. And then embrace the cultural alignment, but also the differences. Look for things that you can learn from one another and really embrace that continuous improvement mindset. So encourage feedback on both internal stakeholders and outsourcing partners. Leverage those insights to drive efficiency gains and innovation there. Gretchen, what are your thoughts?
Yeah, I would say when it comes to global outsourcing, to just, I guess a caution is it's not a set it and forget it type of situation. It's something where you also have to invest internal costs. I sometimes think people think, oh, I'm going to outsource this function and put it over here on the side and I don't have to worry about it anymore. So just one thing I want to caution is that you still have some internal costs, even though you are using global resources. You still have to have managers in the process. You still have to be involved in the process. It's a living, breathing partnership that you still need staff to maintain that. And so there is some cost and you get into global outsourcing to save money. That's one of the primary things we learned in the first poll, but you still have to spend money yourself internally to keep the relationship ongoing and active. And the other thing I want to mention is, you can start small. I know people get overwhelmed when they think, oh, this is such a large project. And we started with a pilot just to see if it worked. We started with 4 AR FTEs to see how it worked. We've since then grown to 15, but first we had to do that proof of concept to ourselves and to our leadership team. And if you're getting pushback from your leadership teams on the whole concept of global outsourcing, ask if you can do a pilot. Say, hey, can I just get a couple FTEs and do them on a very small subset and see how that goes? We started with AR FTEs only working a small bucket of our commercial claims. Once we realized that that was successful, then we were able to grow it. So, there's lots of variances in this model. You can start small and get big. You can pick certain subsets to global outsource and some to keep in-house. So it's a hybrid. So just know as you kind of go down this path that there's no predefined rules. There's no all or nothings. It's kind of what best fits you, your business, your niche, and where you feel you get the most value and save the most cost all at the same time. So it's just to be flexible in your approach. And, that also goes back to having the right partner who you can just openly talk to them about, do you think this function would work? I mean, it's a question you can bring up to Laxmi and she'll help you. I'm thinking about outsourcing this function. Let me tell you more about it. And then she can give you feedback if she feels like it's a good idea. So just don't write anything off. Always be open to the thoughts. I mean, and full disclosure, we tried 3 pilots, 2 worked, 1 did not. We ended up with a function that we thought we could outsource, and it just got too complex and too weedy. And so we scaled back and actually moved those FTEs over to our AR side. So just to be open-minded as you go down this process, that it is very fluid in nature.
All right. Thanks for that. Thanks for that answer. As Ashley mentioned at the top of the webinar, I work on the HFMA podcast, and one of my favorite questions to ask people when we're talking about improvement or outsourcing any function or whatever is, where do you start? No matter what it is we're talking about, where do you start? And so I love the idea of starting with a pilot, because I can't tell you how many people I've had on the podcast who say so many people just jump all in, and then when things go wrong, they don't know how to get out of it. So, just being open to what works and what doesn't, and pivoting when something doesn't work. So I think that's a really good lesson there. So I think we've got one more polling question before I kick it back to Ashley for audience questions. As someone who may be considering global outsourcing, maybe one of the no's at the beginning, maybe if you would answer yes now fast, which pieces of advice resonated the most with you? Understanding the core competencies, selecting the right partner, establishing clear communication channels, or embracing a culture of continuous improvement. I have a feeling, Gretchen, especially if I ask you what you think is the most important, you're probably going to say all of the above.
I could narrow this one down to 2 if you want. I'm going to go with selecting the right partner and establishing clear communication channels. To me, if those 2 things are set, everything else will fall into place. You will still have continuous improvement. You will have core competencies if you have the right partner and you're clearly communicating. So I knocked that answer down to 2 for you.
Well said. Well said. How about you, Laxmi?
Yeah, no, I agree. I think I tend to agree with Gretchen. I think once you identify the right partner, the rest of it kind of falls in place, because you should have already had some of these conversations prior to picking a partner and really understanding what your objective are and what your expectations are from whether it's a communication and so forth. So I think the audience kind of agreed with that statement too.
Fantastic. Well, let's find out what else the audience had to say. Ashley, I'm going to kick it back to you for some audience questions.
Awesome. Thank you to our speakers for that engaging presentation. I would like to invite those listening to enter your questions in the Q&A box located at the bottom of your computer screens. We do have quite a few audience questions. So first one, what are some specific implementations that you've used to control PHI information from being used illegally by global outsourcing partners?
Ashley, I can try to take that on kind of what we do at Civista. There, one is from a data security standpoint, as mentioned, from a best practice, data shouldn't leave the United States. And that's how we approach data, is all information is still on the client server or on our server domestically. Any global talent we have, whether it's India or the Philippines, accesses this data through a virtual desktop with kind of multi-factor authentications there. We also work in a clean environment kind of mindset. So you are there for work and you're there for work only. And so we actually have taxis or kind of shuttles that picks up our staff from home and drops them off from a safety and then security perspective to once they're on site. They have lockers outside of the work floors where they store their personal items. They're not allowed to bring anything from a personal item or device standpoint onto the work floor. So you don't have phones, you don't have an ability to take screenshot or copy snip data. And then we limit the type of access that the colleagues have. And so there is no outside IP address that can be. So they can't go on Google, they can't go on Gmail, they can't check the internet from a news perspective. They're only limited to work related functions and of that client. and not kind of generally. So in some cases, the global environment sometimes tends to be more secure than even domestic, and especially as we get into more of that remote workforce concept, because you don't know what someone's doing from their home versus something that you see and monitor on a constant basis there.
And I agree. I'm starting to feel that our global functions have more security and cybersecurity than some of the things we're doing in-house. And I mean, we're trying to get better, but I feel very comfortable with the cybersecurity aspect of our partnership.
Awesome. Thank you. Next question. In your opinion, what is the best domestic structure to have when partnering with global partners? Do you recommend a committed domestic team who solely focuses on domestic team members, or do you intermix global with domestic leadership?
Gretchen, do you want to provide your perspective on how you guys have structured, and I can give a thought on how we do it too?
Yeah. I mean, I guess an example is, so we have 15 FTEs that are devoted to AR that are globally based. Civista had the management team layered on top of those 15 FTEs. But then we also have an AR supervisor whose job is to work with that team, monitor that team, audit them. I mean, Civista does provide some audit results, which we appreciate, but we also trust but verify, like to audit on our own. So for my 15 AR FTEs, we have one AR supervisor whose job is to just monitor their performance. Our coders, the same thing. You know, our coders are global. There's global coding managers, but we also have on our staff an in-house employee that is a coding manager, and their job is to work with the global resources, monitor, audit, liaison between us. If I have a question, I go to our in-house coding manager or AR supervisor, and then they'll go to the global team and kind of research it further. So you have to have that middle layer, I think, to be successful, to make sure everybody's communicating and everybody's kind of involved in each other's work. Lakshmi, is that how your other clients handle it?
Yeah, most of our clients do have dedicated leadership that is more kind of managing the scope of work or the relationships there. It really depends on the scale and the size there. If it's a couple handful of FTEs, it may not make sense to have dedicated resources from a monitoring engagement standpoint, but especially when you're outsourcing a function, it's really important there. And even from a staffing perspective, Civista's philosophy is kind of a blended model, whether it is blended from a domestic by us or by our client, because no matter what the function is, you're still going to have complexity that needs to be dealt with from a local perspective and communication associated with it. And I think we've seen the most success when we've had that. And also just a one-for-one relationship and contact. All our clients have a client success representative or an account manager there. They are the main point of contact for our client from a relationship and ownership standpoint. And then we have operational managers. They're the main point of contact with operational managers on the client side. So I think having that one-for-one ratio is really important. So you're not dealing with 16 individuals, but you're dealing with the outcome of those 16 individuals to that one leader.
Great. Thank you both. Next question. What strategies do you recommend for keeping domestic staff engaged when sending some of their work offshore?
Yeah, Gretchen, did you have any issues with that when you guys started?
Yeah, we didn't have issues with that because we were a growing company and I just grew the team globally. So we didn't have to go through what could be an awkward sending onshore work offshore. I know it's something that should be approached slowly and cautiously. And again, it's not a complete elimination of one team to add another team. Again, you have to keep the oversight. You have to keep that middle layer. So there is some grayness to that, but we personally didn't experience that, just how our growth model worked. Lakshmi, what's your thoughts?
Yeah, I think when we've seen it with some of our clients where there's two models. One is unfortunately, there are times where you do have to transition work because unless you're growing, you are transitioning work from one person to another, whether it's domestic to domestic, whether it's internal to external, whether domestic to global. So there is an outcome associated with that. But in many cases, it's about outsourcing, and especially globalization, for work that you're already not doing. So low balance sometimes falls off the radar. Your domestic team from a cost to collect ratios don't make sense there. And so it's really clearly communicating with your team on what the expectation is and what the work that is being outsourced is going to be versus what they're working on, and then how success is going to be measured, and creating opportunity between the two parties to really have a collective goal. And so I think Gretchen mentioned this on the KPI section, is revenue by claim or overall reimbursement rates and things that both parties impact, and creating kind of gamification of that, I think really helps from a nervousness standpoint and also an alignment standpoint. So I think you have to be really clear and communicate from an expectation standpoint and really define the goal responsibilities between the two parties. So one, you're not overstepping on each other. Two is I think that gives a little bit of relief that, hey, this isn't going to impact my day-to-day.
Thank you. Next question. Is the offshore staff credentialed with U.S. certifications for coding?
Yes. So depending on the vendors that you're looking at, I think there are some that are non-credentialed for certain services. And that from a Civista perspective, the credentialing is for U.S. coding credentials as required and needed.
Great, thank you. Next question. How do you address the issue where states have laws that do not allow global outsourcing?
Yeah, that goes to that blended model. So there are certain payers that don't allow global access. There are some limitations with some EMRs and EHRs on where the global resources can be or not. So I think having the differential, so even, I don't think there's a full state that doesn't allow globalization. So like the state of Arizona, Medicaid in the state of Arizona doesn't allow global resources to interact with their accounts. But in the state of Arizona, you have, hundreds of other payers, so you can separate the inventory and the responsibility associated with that.
And we actually have a client who doesn't allow it. It's one of our smaller ones, so we do have a domestic resource devoted to it. Not going to let it stop our entire strategic plan just because 5% of our customer base has a restriction against it. We just kind of worked around it. Again, it goes back to hybrid, and it's not an all or nothing model.
Great, thank you both. Gretchen, can you discuss any unexpected challenges or benefits that you've encountered with this process?
An unexpected benefit I have found just recently, last night we were talking about it, is with the current labor market, and our company's growing very rapidly, and to keep enough staff up to sustain our growth rate, I think domestically would have been a challenge, but because of the global nature of it all, it's more of just, hey, we need to increase our FTE count by 3. And selfishly speaking, from my side, that's not a hardship on me. They have the bandwidth on their side, and so it's allowed us to be more flexible and scalable. That's not why we got into this. We got into it for cost and control and to, increase our revenue share. But unintended consequences, we do have a better labor pool, easier to access, scalable. So that's really been helpful for us. I don't have to panic of, we just got a new contract and I have to go hire 6 people and I have to find them and screen them and train them. So that's been a benefit. I'm not sure of any unexpected challenges. I mean, we knew there was going to be some bumps. We knew it was going to be a process. Our account manager has really helped us bridge those gaps and any challenges we have. If we have issues with communication or just expectations, we can go to our Civista account manager who, is in our time zone, in our area, and we can kind of just work through the problems with her. So she's helped us kind of work through any unexpected challenges that we had in that area.
Great, thank you. One more question before we close out. How do you handle cultural differences and communication barriers when working with offshore teams?
Yeah,
For me, Oh,
Go ahead, Gretchen.
Well, I was gonna say that goes back to our account management team that helps us. You know, sometimes we do have some cultural barriers or communication issues, and we can go straight to our account manager and, you know, just have a on the side, off the cuff conversation of, I don't think what I'm saying is getting through, or I'm not understanding what they're trying to tell me. It has happened. But when you have a good bridge in the middle, and, you know, we have our middle leadership, mid leadership, and we have our account manager, and, you know, they work together as a team to kind of work through any communication or cultural barriers we have. And it also kind of goes back to that graph that was up earlier that showed, you know, what functions you want to use outsourcing and which ones you don't. So the ones we are using it aren't as client facing. So that also cuts out on a lot of the cultural barriers because they're doing more of the auditable, measurable, quantifiable tasks that don't require as much face-to-face interactions where you could have some cultural issues occur.
Yeah, and Ashley, from a Civista perspective, we really think about kind of being upfront about the differences. They are, no matter who we are, and it could be from a domestic or a global perspective, is when you're working with a partner, there may be communications. We use different terminology or words that are abbreviations. We have accents from the South to the Northeast there too. And so, like, really being upfront and honest about the differences there, and setting up a structure that allows for outside of that day-to-day to address some of that, I think is important.
A great point. Thank you. Before we close out, do either of you have any closing remarks?
No, I really appreciate the time today, and I really hope the audience took something away from today's conversation.
Awesome.
Agreed. I'll just say in closing, if anybody's considering trying global resources, to just at least have an exploratory call, try a pilot. It's not a jump in with both feet or nothing option. So to just be open and flexible with it and see what it can get you in your organization.
Right. Thank you both. And with that, we've reached the conclusion of today's webinar. I would like to again thank our speakers for presenting and Civista for sponsoring. We hope you found the presentation informative. Thank you for your participation and have a great day.